Hi everyone, welcome back in today's video. So in this tutorial we shall be discussing how to do a general physical examination. So general physical examination usually include that is inspection, that is looking, palpation, that is feeling, auscultation, that is listening, and percussion, that is stabbing. So for example, you start by examining general physical appearance of the patient. You start by examining from the head to the toe. For example, you observe the size of the head, if there's a macrocephaly or if there's a microcephaly. So you also observe the bulge of the patient, that is the height of the patient, the weight of the patient, vital signs, that is the blood pressure, temperature, and maybe in pulse rate.
Everything we were don't make us who we are. So I'll dream until I make it real, and all I see is stars.
Hi everyone, welcome back in today's video. So in this tutorial we are going to talk about how to do a general physical examination. So whenever a patient comes in your clinic, so you have to take first the vital signs. So you have to do a proper history taking and clinical examination. So before you start the procedure, you have to gather all the necessary equipment. For example, you may need a sphygmomanometer for you to measure the blood pressure. You may need a thermometer for you to measure the temperature. You may need an otoscope for you to view the internal structure of the ears. So you may need a stethoscope for you to listen the sounds of the heart or the abdominal or the lungs. So what are the prerequisites for you to do first before you start doing a general physical examination? For example, you have to introduce yourself to the patient first, then you ask him permission for you to continue. So you ask the patient if he's comfortable sitting on the table or lying flat. So a male doctor should examine a male patient and a female doctor should examine a female patient. So that will protect the doctor from accusation of immodest. So general physical examination should be done in a daylight because skin changes are better appreciated in a natural light. So this is how we are going to perform. So let us proceed now. So the first step you are supposed to do is you have to start by introducing yourself. For example, hi, my name is Dr. Dawood. I'm going to perform a general physical examination. So what is your name?
My name is Abdullah.
Okay, welcome. So first you have to start by introducing yourself to the patient. So you have to ask permission for the patient for you to examine or for you to do the general physical examination. So you have to ask the patient if he's comfortable lying flat, that is in a ubiquitous position, lying flat on a bed or sitting on a table. So that is, you have to ask first the patient if he's comfortable sitting or lying flat on a bed. So other than that, so what you do firstly, so whenever you're doing a general physical examination, so there are 6 main areas for you to give consideration before you start a general physical examination. So the first one we have is pallor, the second is icterus, the third is cyanosis, the fourth is lymphadenopathy, and the fifth is edema, and the sixth is clapping. So remember, let me repeat, whenever you're doing a general physical examination, so you have to consider 3 most important things. The first one is pallor, the second one is icterus, the third is cyanosis, the fourth is lymphadenopathy, the fifth is clapping, the sixth is edema. So let us start by examining pallor. So what is pallor? Pallor is the paleness of the skin or the mucous membrane due to the reduced level of hemoglobin level in the blood. So pallor is the paleness of the skin due to reduce the level of hemoglobin level in the blood. So how do you examine pallor? For example, so there are areas whereby you can examine pallor in the patient's body. For example, the first side you can examine pallor is the lower palpebral conjunctiva. So whenever you're examining the patient, so you instruct the patient to look upwards. So you instruct the patient to look upwards and you retract down the lower eyelid. So you retract down the lower eyelid, so you observe if there is any pallor. So in this situation you can see there is no any pallor. So you can say that this patient has zero pallor. So we can grade pallor from 0 to 3, mild, moderate, or severe. So there is another area where you can examine pallor. For example, you can instruct the patient to protrude his tongue. So you can also examine pallor if there is paleness in the tongue. So there is no paleness, you can see. Okay, there's another area where you can examine pallor. For example, you can examine pallor in the palms. If there is any paleness, you can examine pallor in the palms or in the nail. So you can also examine pallor in the nails. So that is how you are going to examine pallor. So what is the cause of pallor? So pallor occurs due to the reduced level of hemoglobin in the blood. So that's how you are going to examine pallor. So the second one we have is icterus. So icterus is the yellowish discoloration of the patient's skin and sclerae that results due to hyperbilirubinemia. So it occurs when the serum bilirubin level rises twice above the normal upper limit. So let me repeat. Icterus is the yellowish discoloration of the patient's skin and sclera due to the increased level of hyperbilirubinemia. So it occurs when the serum bilirubin level rises twice above the normal upper limit level. So that is icterus. So where are you going to examine icterus? So for example, you can examine icterus in the upper eyelid. So you instruct the patient to look down and you retract the upper sclera. So this is how you're going to force feeding. So you instruct the patient to look downward and you retract the sclera upwards. So that's how you are going. So if there's any yellowish discoloration of the sclera, that could indicate there's a presence of jaundice. And if there's no any discoloration, yellowish discoloration, so the patient does not have any jaundice. So that is how you are going to examine icterus. You can also examine icterus if there's any skin yellowish discoloration, maybe the hands, the palms, or the fingers. So that's how you're going to examine an icterus. So I have said icterus is the yellowish discoloration of the patient's skin and sclera due to the increased level of bilirubin. So hyperbilirubinemia. So that's how you are going to examine an icterus. The third we have is cyanosis. So what is cyanosis? Cyanosis is the bluish discoloration of the patient's skin and mucous membrane due to the deoxygenated hemoglobin level in the superficial blood vessels. So cyanosis means bluish discoloration of the patient's skin and mucous membrane due to deoxygenated hemoglobin level in the superficial blood vessels. So we have two types of cyanosis. The first one is central cyanosis. So this occurs when there is abnormal amount of deoxygenated hemoglobin in the blood. So you will observe bluish discoloration of the tongue. So we also have peripheral cyanosis. So this occurs when there is poor blood supply to part of the body. So you will observe bluish discoloration of the lips. So what are the cause of cyanosis? So central cyanosis can be caused by a decreased arterial oxygen saturation, that is high altitude or lung disease. Number two, if there is a hemoglobin abnormalities. And what are the cause of peripheral cyanosis? So peripheral cyanosis can be caused by number one, exposure to cold. Number two, cardiac disease. For example, we have congestive heart failure, left ventricular failure, shock, arterial or venous obstruction. So that are the cause of cyanosis. So how are you going to examine cyanosis? For example, you can instruct the patient to protrude his tongue. So you can observe if there is bluish discoloration of the tongue. Okay, you can also examine cyanosis if there is bluish discoloration of the lips. So that is how you can examine cyanosis. You can also examine cyanosis if there is a bluish discoloration of the skin, or maybe in the axillary, or maybe the cheeks. You can examine bluish discoloration of the skin due to the presence of cyanosis. Okay, the fourth we have is clapping. So what is clapping? So clapping is the bulbous enlargement of the soft part of the nail bed. So what is clapping? So clapping is the bulbous enlargement of the soft part of the nail bed. So what is the cause of clapping? So clapping can be caused by due to cardiovascular disease, or for example we have congestive heart failure, or left ventricular failure. Number 2, respiratory problem. If there is lung abscess and lung fibrosis or maybe lung carcinoma. Number 3, if there is gastrointestinal disorders, for example, liver cirrhosis, inflammatory bowel disease, or maybe bilharzia bulbosis. So that are the cause of clubbing. So how do you examine clubbing? For example, you can examine clubbing in the soft part of the nail bed. So we always grade for a clubbing. So grade 1, there is a softness. There is a softness in the soft part of the nail bed. Grade 2, so there is obliteration of angle. For example, there will be obliteration of angle between the nail and the nail bed, or there will be a generalized swelling. There will be a subcutaneous tissue swelling over the base of the nail. So that is how we grade for clubbing. So that is how you examine clubbing. Number 5, we have lymphadenopathy. So what is lymphadenopathy? It's the enlargement of the lymph nodes. So lymphadenopathy means is the enlargement of the lymph nodes. So what are the cause of lymphadenopathy? So lymphadenopathy can be caused by a number of factors. For example, we have lymphoma, we have leukemia, we have infections, we have viral infection, for example HIV, we have bacterial infections such as tuberculosis or maybe syphilis, or maybe due to infections. So that are the cause of lymphadenopathy. So where do we assess lymphadenopathy? So you can assess lymphadenopathy in the following areas. For example, in the cervical, you can assess if there is a tenderness or maybe swelling of the lymph nodes. You can also examine a lymphadenopathy in the axillary. So you can examine in the axillary, that is the armpit region, if there is any tenderness in the lymph nodes. You can also examine in lymphadenopathy in the occipital region, that is back of the head. So you can examine, so this way you can examine in the occipital region of the head, that is the back of the head. So this way you can examine if there is a lymphadenopathy, that is the presence of tenderness or swelling of the lymph nodes. Okay, the last one we have is edema. So what is edema? So edema is the fluid accumulation in the interstitial spaces of the skin. So we have beating edema, we have non-beating edema, we have localized or generalized. So what are the cause of edema? So we have two types of edema. We have bilateral edema and unilateral. So bilateral, there is edema in both sides of the leg. Unilateral is swelling in just one leg. So if there is bilateral edema, that can be the cause of congestive cardiac failure or left ventricular failure, hepatic, for example, liver cirrhosis, renal disorder, for example, nephrotic syndrome, allergic disorders, or endocrine disorders. For example, we have myxedema. We also have toxic, that is epidemic. We also have maybe nutritional disorders. For example, we have anemia, or if there is peri-peri. In the unilateral, so there is a lymphoma, for example, that is filariasis, maybe due to radiation or metabolic disorders. Infection is maybe there is traumatic injury if there is swelling in unilateral swelling. So that's how you can identify the types of edema. So for example, how will you assess edema? So we assess edema in the lower limbs, that is the legs. So this way you're going to examine edema. So for example, you can use your thumb to press if maybe there is a swelling, or you can also apply pressure on your thumb here if there is any swelling. So I hope there is no any swelling now, there is no any edema. So this way you can assess if there is edema, or maybe sometimes there can be generalized edema. For example, the whole body, the face, the cheek, or maybe the hands, or maybe the legs, that is generalized edema. So thanks for watching. Have a nice day.